Hello everyone, I Dr. Chalashri Ransne welcomes you all in 11 days free webinar series organized by AIHSAYA in association with Samragee Homoeopathic Clinic. Today is a third day and it's a fortunate to have Dr. Samir Upadhyay sir. Heartily welcome sir and all the participants. Thank you.
Thank you all for joining. Since one of our member is not present due to network issues, so I am taking over this. So welcome you all. And before that we start, I would like to say something about Aisha. I know it's totally different, and I don't do usually this. So Aisha's full form is All India Homeopathic Students and Youth Association, and we focus on various things such as medical school means libraries and medical camps and other things which can be best guided by one of our best member. But since network issues have taken over, so I can say only few things. So now our webinar thing was started everywhere. Oh, okay, I'm taking over Divyasree ma'am, and she will guide you with this. Over to you, Divyasree ma'am.
Hi, sorry for little delay. I have to say a few words about AISHA. That is All India Homeopathic Students and Youth Association. It is one of the largest association of homeopathic students and youth of the country. This association plays a great role in the upliftment of youth and young homeopaths to take the responsibility on their shoulders. This is the association of the students, for the students, and by the students. The aim of this association is to work selflessly for the upliftment of ailing humanity. We believe on the phrase, united we stand and divided we fall. So, this is the right time for all the young pets across the country to come together and work for the betterment of the nation to make India a most powerful nation by devoting their time and work in right direction for the nation. We organize free health camps, free seminars, free webinars, blood donation camps, and we also have also developed our own library which we give to the students who are not able to afford books. Aisha family conduct on 8 OPDs at remote village areas. We also promote scientific and research oriented mind of the youth by publishing their articles of or presentations or any kind of literature which is of value for the homeopathic fraternity and for the humanity in our magazine called Homeo Vision. We believe in the importance of time, so our motto is to awake, arise, and work before it's too late. Because aim says, I am always watching. Our thoughts are our actions. So we believe in having a positive mind to believe ourselves for rising above monsters to higher purpose of things. Thanks.
Ma'am, you unmute yourself. You are being muted. Yes, continue, ma'am.
Sorry,
Over to
guys.
you.
Samragee Homoeopathic Clinic. Homeopathy system based on the theory of treating like you. Homeopathy claims to stimulate healing responses to diseases by administering substances that mimic the symptoms of those diseases in healthy people. To provide the treatment of this wonderful system, Dr. Vibha Mevada, who is a budding and enthusiastic homeopath, has started Samragee Homoeopathic Clinic on 4th February 2018 at Indore, Madhya Pradesh, India. Dr. Vibha Mevada did BHMS from Nasik University in 2015 and did CCH certified course in advanced homeopathy and MCH master course in Homeopathy, which are short-term PG course from the most prestigious institute, the other song, International Academy of Advanced Homeopathy, Mumbai in 2016. And ma'am is a certified yoga instructor, scholar by Yoga Certified Board, British Government of India. Dr. Vibha Mevada has been under renowned homeopaths like Rajan Shankaran sir, Dr. Chauhan sir, Dr. Gaurav Gaikwad sir, and many more across many national and international webinars, and her articles and cases are published in many prestigious platforms of homeopathy like National Journal Homeopathy, homeopathy.com, etc. By following the footsteps of father of Hahnemann, Dr. Hahnemann, rare diseases are also being treated at Samragee Homoeopathic Clinic. The main intent of Samragee Homoeopathic Clinic is to serve people. See several health camps, medical camps, free yoga and aerobics workshop, and has been conducted at the clinic as a benefaction to people. There is no denying to talk that they do treat here their best to assure the satisfying results leading to a life line to better health. Thank you.
Thank you all. So bringing up on screen our collaborator, Exactness Homoeopathic Clinic's founder, Dr. Vibha Mevada, ma'am, for introduction of speaker and introduction of herself. Over to you,
Okay,
ma'am.
Doctor. Thank you, Dr. Arka. So, as we all know, today's our speaker is Dr. Samir Upadhyay, sir. So, as we all know, sir doesn't need any introduction, but as a part of program, I just want to introduce sir in short, and I feel very happy to introduce sir here today. So, Dr. Samir Upadhyay, sir, is a MD homeopath and practicing for last 34 years in Surat, Gujarat. Basically, self-made and learned from many legendary homeopaths like Dr. Rajan Sankaran, Dr. Jayesh Shah, Dr. Vijayakar, Dr. Sehgal, Dr. Sarkar, and many more, and is still learning. Sir is attached with C.D.P Homoeopathic College, Surat, as a professor in Materia Medica for last more than 15 years. Also having OPD in college and seeing more than 100 cases in 2-3 years, having 3 clinics in Surat and seeing 100 to 1 or 10 cases in a day. So, doing regular webinars internationally and internationally. So, this is in short about the sir. So, we are really very fortunate to have you on our stage today, sir. No doubt we are going to learn so much by the experience of your a big experience of your today. So thank you so much for accepting our invitation for today. Thank you.
So now it's time to bring up our guest, Dr. Samir Upadhyay, sir. Hello, sir.
Hello.
Good evening, sir.
Good
Over to
evening.
you, sir.
Thank you. Thank you very much, Dr. Vibha, for nice introduction. And thank you to whole team for providing me just a platform to share what I learned from my teachers for last more than 30, 34, 35 years. And I was happy to share what I understood in homeopathy. And still I am learning. Basically, I am the very lucky person, I can say, to learn from the legendary homeopath like Dr. Rajan Shankaran, Jayesh Shah, Sunimar Sarkar, Vijayakar, Sehgal, and many, many more. But one thing I want to say, when I passed out from my college, on the second day, as soon as I got my result, final year DHMS result in 1986, next day I went to meet Dr. Rajan Shankaran, sir. He told me a beautiful sentence. Very first sentence he told me. For me, it's just an advice. And I would just pass on this advice to everyone. He told me very nicely, look, young boy, you cannot wear someone else's shoes and walk. You have to wear your own shoes and walk. If you understand that much in homeopathy, you will be you will get a much more in homeopathy. You will be benefited a lot. And that advice I still convey to all my students. And still I remember every word of that. That was a golden word from my guru, Dr. Rajan Shankaran sir. So I'm not wasting the time. So basically, Dr. Vibha already talked about my introduction. I'm a self-made person. I learned from many homeopaths by attending almost all the seminars and workshop and all, reading their books, reading the old journals, reading Materia Medica, and develop myself. And still remembering the word of Dr. Rajan Shankaran sir, and still learning, still reading almost daily, and that helps me a lot. So with that, I start my session. Share screen share. Huh? Oh. I think you can see the screen.
Yes, sir. The audience are able to see your screen, sir. You continue, sir.
Okay. Okay, thank you. Okay, fine. So I start my topic with taking blessing of my guru and our guru, Dr. Hanuman sir, and with respect to my teachers. Without him, I cannot reach where I am now. Just I want to show you few photographs how homeopathy help in such type of cases. See, everyone knows the efficacy of the homeopathy. But just I want to show you something. This is a case of a brain tumor. One can see the huge tumor on the left occipital side. This case was a malignant brain tumor, operated twice, and third time he developed the tumor. And that time he consulted me around 1 year back, exactly 1 year back. Last November he consulted me, and I gave a remedy. So this is the tumor, huge tumor, and he was advised surgery again, and patient was not ready for surgery. And because of the tumor, he lost his vision, he lost his hearing. He is around 55 years old. And after the treatment, this is the result. Just within 6 months, tumor disappeared completely. And the patient, so just the very simple remedy I prescribed. Remedy I prescribed was Nux vomica. Still, patient is on Nux vomica 0/10, daily 1 dose. And slowly or slowly, he started getting his vision. He can hear now everything. Hearing is completely better now. But his vision is started improving now. I want to show you photograph of another disease of severe pemphigus. So I never come across such type of worst condition. It was really worst. I'm just showing the photograph of the upper and lower limbs. He was not allowed. He has not allowed me to take photographs of whole body. Just see the condition of the patient. He was suffering for many years. before treatment. He is already on immunosuppressive therapy when he consulted me. He used to get recurrent infection, upper respiratory infection, recurrent pneumonia, and such type of things. And this is during treatment, 2.5 months after the treatment. See the improvement. I prescribe remedy, arsenic alb, 0/2 daily dose, and slowly he recovered beautifully. So just I wanted to point most important sentence Dr. Hippocrates taught about. The Hippocrates, the master of medicine, stated that a good doctor must be a good cook. He also wrote that no man can be a good doctor unless he loves the art of healing. He loves the mankind and he loves his patient. Just remember this sentence and beautiful sentence he talk about. You can be a good doctor if you know what is art of healing. You love the mankind and you love your own patient. That means you need the dedication. If you have the dedication, then and then you can be a good doctor. See, every homeopath get the failure. I also get a lot of failures in my day-to-day practice. But we learn out of that failure. We just think over why we get the failure, where we failed, what mistake we did. And with that mistake, we learn. And now I can say with proud that my success rate is more than 85%. I can say it's good. See, my way of practice is a different practice. When I am in the college OPD, where lots of patients are there, where I see more than 100 cases in 2 to 3 hours. Just believe one in any homeopathy, one cannot see that 100 cases in 2 to 3 hours, including 10 new cases. I give it 3 minutes to new cases and half to 1 minute for the follow-up. With this such a excellent percentage of results. This only comes when you have the knowledge of Materia Medica. When you know what to treat. Once you know what to treat, then everything is easy. So what is most important thing as a homeopath is, see, arriving at the similium is the prime objective of any homeopathic physician. And that also, the task need to be accomplished in easy, quick, and most accurate and reliable way. What is the word is quick, accurate, and reliable. These words are very, very important things. Your results should be quick, your results should be accurate, and results should be reliable. And that only comes when you correlate Materia Medica and the repertory. You can see, you can understand the patient well. You can see exactness of that sentence of the patient, and you see the exact same kind of sentence in the Materia Medica or the repertory. For that, you require certain knowledge, particular knowledge of the Materia Medica and knowledge of the repertory. One cannot treat every case with a one single type of repertory. Every case require different approaches, different repertories. One should know which case it requires, and then one can get the excellent results. Dr. L.M. Khan of Calcutta emphasized the need for synchronous understanding of the patient by perceiving and having a bond with him. What he says, perceiving the whole through whole. Whole is essence of life. What beautiful sentence now we talk about? He says that if a symptom does not leave a patient, just remember this sentence. If the symptoms does not leave a patient, which symptom, which is persistent symptoms.
Sir, your voice, we are unable to hear your voice, sir.
Not audible.
Sir, now it's some sound is coming on, sir, like a cracking sound, sir.
Okay. Now is
Now
okay.
it's okay, sir. Yes,
Okay,
sir.
fine.
Now it's okay.
Okay. Okay. So start with a recent case, and I can say everybody, if we discuss, if we question and answer, or if we talk about the medicine and all, that will be much better. If we share the knowledge, then it will be much better. Everybody allowed to talk about. Everybody allowed to see share the remedy. What remedy patient is need for. So this is a very good case, very small case. So before I go with the case, I can say very important thing. If you start any damn case, whether acute or chronic, first 10 to 15 minutes are very, very important. If you concentrate on the 10-15 minutes in the beginning of the case, means the chief complaint, I can say 90% of my cases, I reached the remedy on just 10-15 minutes. Rest of the hour or so, I just go and confirm with the remedy. First minutes are very, very important. Just concentrate that first few minutes. So one day I got the phone call from one of my patient's relative for an emergency appointment. So that day my OPD was very full. It was very difficult to manage any patient. And she was having acute renal colic for last 4 days. She was already on homeopathic treatment. And the homeopath prescribed Berberis vulgaris 200 QDS, along with Berberis vulgaris Q 5 drops QDS. But she was not better. She was requesting me on the phone to help her. She said, pain was very unbearable. Please help me. I also took the painkillers and painkiller injections with just relief for a few hours. I said, tell me something about your pain. So at that time, when she talked about that, almost I was with the remedy. I was with the 3 remedies, and I have to confirm out of 3 remedies at this moment, at that moment of the case. So I asked her, tell me about the pain and tell me about complaint. She said, along with the pain, I had a constant nausea for last 4 days. I'm just tired of this pain and nausea. I cannot bear anymore. And along with the pain and nausea, having this profuse perspiration of the body, and the patient was chilly. So patient was chilly, she likes to cover, but during the pain, she keeps her abdomen uncovered. That gives some relief to the pain. What could be remedy? Any suggestion? Anybody can write down in the chat and
There is no suggestion until now, sir.
okay. Can I go ahead with the things?
Yes, sir. If suggestion comes up, we'll show you on the Q&A portion, sir.
Okay, fine, fine. So what to give? What rubric to consider? This is a very simple case. What I tell you in the beginning, the result should be quick and it should be permanent. It should be complete. So I took a rubric: kidney pain left, colic with, pain nausea with, kidney colic worse left side. That was from the boric repertory. Fourth rubric for the boric repertory. And stomach nausea, uncovering amelioration abdomen. Only single remedy rubric. That was. And I just want to tell you, in my each and every case, I get one rubric which shows a single remedy. In every damn case of mine, in my day-to-day practice. And that gives me the confidence. So I gave a remedy, tabacum. Tabacum 30 was given 2 hourly. And after the second dose of the tabacum, pain was completely better. And 2 days after, I got a phone call that a stone came out in the morning. See, so quick. If your remedy is right, you get a very quick results, very fast improvement. See, now we just see where it is in. Exactly a present description should be matched with the Materia Medica. What Boric has written? Renal colic, violent pain along the ureter and the left side. What the Fatak has written? Renal colic, which is cold sweat and deadly nausea. Beautifully, everything exactly matches. If at this point, the patient is having pain on the right side with lots of vomiting, then remedy will be osmium can. And rest of the another two remedies on the left side, I call it what Boric had mentioned. The cantharis, berberis, and tabacum. So go with another beautiful case. This is a case of a triple vessel disease, acute infarction with a 3 vessel block, where the patient was advised immediate bypass surgery. Then I want to show you how I understood the patient and how convert that understanding the patient into the rubric and how I match with the Materia Medica and the repertory. I will show almost exact feeling, exact sentence in every cases. A patient aged 55 years came with a complaint of chest pain for last few days. So basically this case referred to me by one of a homeopath. He called me one day. So can we treat such type of pathology where patient is advised immediate bypass surgery? A patient is already in lots of pain. can homeopathy helps? I said, yes, homeopathy can help if I get the right remedy. So the patient is one of the relatives of the homeopath. So he brought this case to me, and what the experience of the patient were, what he says, that having heaviness and a tightness in the chest with difficulty in breathing. The chest pain aggravated on slighted exertion. Not only exertion, even during the rest, he used to get the chest pain. When person get the chest pain during the rest, particularly the heart complaint or angina, then it's alarming condition for everyone. He could not exert much, and even during the rest, he was getting angina pain. I said, tell me more about your pain. No, this is my common questions. Every time, tell me more, tell me more, tell me more. Unless I get satisfied with the patient's answer, I go on asking, tell me more. He said, whenever I get the chest pain, and along with the chest pain, I feel like gola in epigastrium. What is gola? I don't know what is gola is. And you feel something moving in the abdomen. Basically, it's Kathiawadi. So our language was different. He was feeling lots of discomfort in the epigastric region. So along with the chest pain, he used to get a pain in the left hand with a numbness in the upper extremities. Classical symptoms, classical pathology of the angina pain. Classical description of the angina pain. Pain in the left side of the chest with the radiate to the left hand, with having the shortness of breath, and a need fan, constant fanning. He also had a tingling in the soles. He was diagnosed as a case of triple vessel block and would advise immediate bypass surgery. Left ventricular ejection fraction was just 30%. Now imagine the condition of the patient. This was the report. Echo to the echo. LVEF 30% before treatment when he came to me on 25 or 22 5 19. 22nd April 2019. He came to me. After 12 days of the treatment, LVEF went up to 48%, just with a single dose of a remedy. And after 9 months of treatment, it completely normal. 62 to 63% LVEF. And the same cardiologist says you don't require bypass surgery now. Such a beautiful improvement with the homeopathic remedy, with very infrequent doses. What could be the remedy? How to understand such type of patient with acute pathology, very severe case? You should show the result to allopaths. Then they can believe in homeopathy.
Sir, sorry to interrupt in between, sir.
Huh?
Let me just tell you, this stream is being delayed to 30 seconds. So whenever you ask a question, the viewers will get it with a 30 seconds delay from the real
Okay.
time. So
Okay.
if you can wait for 30 seconds for the answer, because on the last question you asked,
Okay.
there were answers before you just revealed the answer. There were some answers, but it came shortly. So that's why, sir.
So I
So
cannot
please, if
I
you ask
cannot
any
see on the
question.
screen. I cannot see on the screen.
Okay, sir. If comes any answer comes, I will share it on you, sir, by coming up
Okay,
on the
fine.
screen, sir.
Okay, thank you very much.
Thank you, sir. Continue, sir. Sorry for the abrupt
It's okay, no problem, no problem,
interruption.
no problem, no problems. Okay, fine. What remedy you think of? How to proceed with this particular case?
Sir, there is an answer
Huh?
from Gaurav Prajapati. He is
Huh?
saying Diosera villosa.
Okay, good, good, fine. I just took a rubric and I congratulate Dr. Gaurav, remedy diastoria villosa. We hardly think such a remedy in acute heart problem, in acute angina. The rubric I consider is angina pectoris tourniquetia, angina pectoris flatulence with single remedy rubric, and extremity numbness, insensibility, hands. And remedy was diastoria. How many homeopathists think about diastoria in cardiac problem? See, your knowledge of matrimony that helps. Your knowledge of repertory that helps. In repertory, you should know what to see and where to see. The most important, what you are treating, what to treat. That has to be clear in your mind. And then you can reach to such type of rare. It is not a rare for the such a pathology. So I gave a diastoria. I just show you the report Materia Medica description. Boric had mentioned angina pectoris, pain back of sternum into arms, labored breathing, feeble action of the heart. So beautiful sentence. Left ventricular ejection fraction was just 30%. They shows the feeble action of the heart, especially with fluctuance. So beautiful sentence. Boric has mentioned. A pain to chest and tightness across. See exact sensation of constriction and tightness in diastoria. So I already gave the follow-up. 9 months, after 9 months, patient is much better, and even today he is doing exceedingly well. I just want to tell you one thing. In between, he had severe pain in abdomen, very severe pain. He took injection every. He is not staying in Surat. He is staying at Saurashtra. She called me on phone that I have a very severe pain in abdomen, and with that I cannot bear, so I took injection. And even with injection, he was not better. I said, "What give you the relief?" And he says, "I will feel better when I smoke BD. After smoking, I feel much better. My pain in abdomen has disappeared." And in between, I gave a 1 dose of Colocin 200. And with the Colocin 200 1 dose, within few minutes, pain completely disappeared. And still today, that never happened. The patient is doing exceedingly well. What I wanted to emphasize on, just understand the patient completely, thoroughly, understand the language of the patient, understand the feeling and the sensation of the patient. Don't jump to the rubric, don't jump to the remedy. Just understand patient properly. Then convert that language into repertory. A repertory is such a tool that helps you a lot. I cannot do anything without repertory. 1,000 times in a day I open repertory in every cases. So beautiful case, I'm just talking with very small child. Sorry, the case of a homeopathy doctor, beautiful case. Just improvement in a 24 hours, in a 12 to 24 hours. She came with a complaint of severe pain in lumbar region, which were extending down to the both the legs. She's 40 years old. She also had a tingling and numbness of the both the legs. A backache is better aggravated by sitting long and walking long after, and better by warm application. So I'm not going to ask about the remedy now. At the end, any question will become, we will discuss about that. So that will, we can just save the time. She also complained about leukorrhea, which was very profuse and offensive, ropey and stingy. And this leukorrhea was running down the legs and staining the clothes yellow. Menses were regular. She complained of heaviness of breast before menses, and her sexual desire were increased before menses. She is Muslim by caste and she is unmarried. By nature, she gets angry easily and she feels repentance after anger. She had a lack of self-confidence. She was very loquacious. And throughout the case checking, she was talking about her problems in the relationship constantly. So what type of loquacity is? She talked only about the problem in the relationship throughout the case taking. And that was the most peculiar aspect of the case. She was absolutely fastidious and her mood changes very frequently. She get the frightful dreams. She had a strong desire for eggs, sweets and chocolate. And that's the case. How I analyzed the things, and the remedy which I gave her was, I took the following rubrics: mind loquacity, anger altered with the quick repentance, dreams frightful. See, beautiful rubric: lamenting, moaning, wailing, relationship about human. Only single remedy rubric again. These are for chocolate and these are for eggs. The remedy I prescribed was lac humanum. So, and so many cases of lac humanum. So to her, I prescribed lac humanum and see the improvements. The next day morning, she just WhatsApp me. So this is the rubric which I can took it: lamenting, mourning, wailing, relationship about human. Single remedy was given in complete repertory. Lac humanum. 200 single dose was given. Almost 1.5 to 2 years has passed. She is completely better. I have not repeated a single dose up till now. She next day morning she called WhatsApp me. Thank you, sir. 80% better in leukorrhea. She also had a lot of urgent urination and or 2 hourly. Please save this medicine name. Whenever I suffer from that problem, easily I can take it. Next day, he says urgent of urine also better now. Try to go and washroom every after 2 and 3 hours. Liquor also better. My today little backache. I have taken warm water bag. I know back problem takes time, but feel better than before. So next day morning she was better by 80%. Single dose. She's so much fast our homeopathic medicine is. I have seen in so many cases. I asked the patient to take medicine in front of me. And after 5 minutes, after say 10 minutes, patient is completely better. In so many cases. So this is case of a child, small child with urinary tract infection. One day night at 8:30 p.m., I got a phone call from one of my old patients that the doctor is having severe, very high fever. and why he wanted to meet me immediately. I told to come next day morning because few more patients were already waiting in the waiting room. Already I was late, but she was insisting me to see immediately. So she came at 9:30 and I started taking case at 10:30 p.m. at night. The mother told me that she is screaming and shouting and calling from inside the toilet. She is having severe urinary infection, lots of burning in the urethra. And she is from the toilet, she was just screaming and shouting and calling her mother inside into the toilet. And when mother went into the toilet, she was not allowing her to go out. Mother told that suddenly, since evening, she started getting severe urge to pass urine. Then she started going to toilet to pass urine after every 10 to 15 minutes. The girl asked her
Sir,
mother,
sir,
hello,
there are a question answer, sir. I think
uh,
it's answer for this question, sir.
okay,
There is answer from Homoeo. He has answered twice.
uh,
First time is of crocus, and then second time is of lachesis, lac.
okay, okay.
And then there is another comment from Thakar Komal. It
Hmm,
says lac humenum, huminum.
hmm. Okay, good, fine. So I continue with this case of urinary infection. So the girl asked her mother to stay with her constantly into the toilet, not allowing her to go anywhere as she was not feeling well. So within half an hour, her problem became severe and she started weeping and asked her mother to come inside into the toilet and stay with her because she was not able to pass urine. She's a condition of a small child. She was around 4 or 5 years old. I don't remember just now. And she severe pain. She was screaming with the pain. She was shouting with the pain in from inside the toilet. She asked her mother to stay inside the toilet, not allowing her to go anywhere. See the state of the person, understand the state of the child, and that convert that state, that expression into the rubric, and see what remedy come up. So she told her mother that it hurts a lot, it burns a lot. When mother asked her what exactly the problem is, and child irritantly asked her mother not to speak with her, just stay there quietly. She was not ready to give answer even. Child held her hands of her mother very tightly inside the toilet while passing the urine. She was constantly holding her hand of her mother while passing the urine. It was so much painful, so much burning. She at the end, mother told me that this is her general tendency. Whenever she falls sick, she does not allow me to go anywhere. I have to be with her all the time. She does not leave me even for a minute. This is the case. I just show you the response of the medicine before I go to the remedy. After 5 minutes of taking medicine, she came out of the toilet and went to the bed. Then within 10 minutes, she slept well. Next day morning, when she woke up, she was absolutely fine. No pain, no burning, no frequent urination. She was as normal as usual. What could be the remedy? Any suggestion? This is a beautiful case. And I prescribed very simple remedy.
Sir, let's wait for 30 seconds.
Okay.
Sir, there is a answer, and I think this viewer is confused with
Yeah.
two answers. Like the first one, he's confused with Lyco, and second one is
Okay.
of Bismuth. Any one of
Bismarck.
this.
Okay, good. Let's see what I
And
will come up.
one more, sir. One more is from another person, Viva, asking for saying calcarea carb.
Calculated carb. Good. Fine. Let's see how I understood the case and what rubric I considered it. So I took rubric clinging person or furniture to, shrieking, screaming, shouting, pain during, holding or being held desired to, irritability spoken to, clinging children of, clinging takes hand or a part of a mother will always, and disturb aversion to being. So these are the rubric which I consider for the child, and I give a remedy Jalsemium. Jalsemium 30 dose. As I already show you the improvement. Just within 5 to 10 minutes, patient came out of the toilet and went to sleep. So not a single allopathic medication that acts so fast. And I saw the smile of the child on next day morning. She was so much happy. And that gave her total job satisfaction. We need something good for someone who is suffering a lot. And that's the beauty of homeopathy. Okay, fine. So what is homeopathy is? I just go with few slides of general. Everybody knows about what is homeopathy is. It's just science and art. I'm not going into detail of what is science and what is art is. Everybody that you all learn from the college. I'm not going into detail of that things. So homeopathy is the only a discovery of truth and eternal law. That's nature's gift. Homeopathy is a discovery of truth that there is a variety of simple substances in nature, each of which, when taken in a large quantity by a healthy person, can produce symptoms exactly corresponding to the particular type of sickness on the earth. And the same substance can cure a person with those symptoms. Everybody knows about that sense. I'm not telling anything new. So, on one hand, we have a symptoms of the patient, and on other, the symptoms of the drug. Or otherwise, we call the disease force or the force, drug force respectively. So, there is very important uh, principle we are having individualization. So, this is one of the most important principle where the homeopathy works on. So, each person has his own individual, different and peculiar disease. If we have a same kind of pathology like diabetes or hypertension, its expression will be completely different from individual to individual. Each one shows its individual peculiar characteristic of symptoms. And then what 153 aphorism is, on which we prescribe the remedy. Here we say individualizing homeopathy has survived and will survive still because it works. It works and no other form of homeopathy will work because it based on solid principle of holism and individualism. We are not treating the disease, we are treating the person as a whole. And these two principles, and because of that, homeopathy will survive and it will survive forever. So I'm not going into the detail about the case study and all. So after studying from so many masters, so many legendary homeopaths, what I understood is, and that from study from the different masters, But what was common to all of them was inquiry into what is peculiar for that individual. Inquiry, what is strange, what is peculiar. And that is the most important things. That is common what I understood from every homeopath. The basic things. Whatever story we made, that all the stories, still homeopathy is there on the basic. We should not forget our basic things. So just go with a one simple case. A case of a very lean and thin boy came with a chronic cough and was not better after giving so many remedies. I gave her so many remedies. It was my initial failure case. So he had a very dry cough, and that cough aggravated only when he looked upwards. The boy was very lean and thin and very emaciated. He was a hot patient. What remedy we think of? Any suggestion? Just 10 minutes, 10 seconds for that. What remedy clicked in their mind?
Sir, just wait for a few more seconds, sir. Sir, let me just tell you the previous question's answer. There were two more answers with the from the same person. That's Homoeo cell was telling about Bismuth, then someone was telling about Bismuth, Sumit Zalavadia, then Gujarat Prajapati also told about Borax. But after that, they realized the real answer. So I hope they got their answer. And
Okay.
still now, sir, no question, no
Okay,
suggestion
fine.
from here, sir.
Okay, fine. I took a rubric. Cough bending head backward aggravates and cough dry emaciated boy in. And the only remedy was lycopodium. Just gave a 30 potency, one dose, and the patient is completely better. So this is the beauty of a repertory. So I go a little faster. So I have a very less time. So again a very good case of recurrent tonsillitis, where an ENT surgeon advised surgery, and she was very much scared of operation. So she came for homeopathy. She had a fear that if anesthesia will given to her, she will not come out of it. She was very scared of darkness in childhood. Cannot stay if light goes off. She will get palpitation and suffocation. And she also had a history of anticipatory anxiety before exams. She used to get blank before starting the examination paper. What is the remedy? That's it. That's the case. What remedy do you think of for acute tonsillitis, recurrent tonsillitis?
Someone just answered, Joseph. I don't know that thing. I think that was previous question answers. The previous question
Okay.
answer. Let's wait, sir.
Okay.
Friends, here a few more seconds. Sir, there is an answer from Thakar Kumal. He or she answered Athusa.
Very nice. Absolutely right. Congratulations. I took rubric, only two rubrics, mind, fear, sleep. To close the eyes, list it should not, it should never wake. Fear, sleeps. To close the eyes, list he should never awake. And anxiety, darkness in. And remedy, only remedy they came up was the Ethusa. So this is the way I work in my day-to-day practice. I'm just showing few cases, the way I am working in my cases, in my clinic as well as in the college. So what is case taking is? It's a unique art of getting into conversation, observation and collecting information from the patient as well as from the bystanders to define the patient as a person and the disease. The history obtained thus makes the basis for the physician to go further into the physical examination, laboratory study in order to define the problem accurately. Each case is a unique in all the respect. Only true individualized approach can explore the true picture and help a physician to arrive at totality in its true sense. Every individual is different in health as well as a disease. Remember this sentence, very important sentence. Every individual is different in health as well as in disease, and hence every case has to be examined individually, given importance to its unique expression during health as well as during the disease state. One should know what is healthy state and what is disease state. Then and then we can understand what disease is. So what is definition of case taking is? Case taking is a process of collecting all the facts about the patient using various tools like observation, perceptions, history taking, given by the patient as well as by attendant, clinical examination, etc., in order to find a remedy for the patient using our knowledge of homeopathic materia medica, organ of medicine and the repertory. Now, this is definition of homeopathic case taking. If you understand this definition, you can understand almost much more thing about the homeopathy. I just go with one or two cases and I finish. The case of very beautiful case. A lady aged 43 years was suffering from migraine. She was given cocktails in the different potencies. It is my failure case initially with much relief according to the patient. Patient said, I'm feeling better. She used to get lot of frequent attack, 2 times, 3 times in a week. And after cocktails, she used to get once in a 15 days, once in a month. So she was satisfied with the improvement, but I am not. She also had a lot of problems, severe joint pains and back pain. She also had a severe motion sickness. And because of the motion sickness, she was avoiding to come to my clinic because she stays 70 kilometers far away from my clinic. So all those complaints were persistent in spite of giving cocktails. So I decided to retake the case and I got the following information. What she says? My joint pains increases when weather gets changed during rainy weather, particularly during rainy weather, and before the rain or windy weather started. This she has never told me in the 2 years of case, 2 years of treatment. What she says? Joint pains increase when weather gets changed during rainy weather and before the rain or windy weather starts. Then she talk about the Beckett, particular lumbar region, feels as if it will broke. I cannot sit for more than 15 minutes. I have to walk to get relief. A headache is altered with Beckett, feel severe weakness, extremely severe weakness after headache. Now what remedy you think of? Any suggestion? I'm giving just 10 to 15 seconds because I'm shortage of the time. I have to finish one more case.
Let's wait then for 15 seconds.
Okay, fine. Any suggestion?
Still not came any, but we can wait for 5 more seconds. We have time, sir.
Okay,
Just wait for
okay,
5
okay,
or 10
fine.
more seconds. To all viewers, please suggest any answer. We will be waiting for 5 more seconds. Okay, sir, you can continue. There are no more
Okay, fine.
suggestions.
Okay, fine. So
Sir,
to
there is a last minute suggestion, sir. Um,
okay.
from Shruti MG.
Hmm.
She's saying phosphoric acid, then Thakar Komal saying sepia, then
Okay.
Dhruvi Ghori saying Briannia alba.
Okay. Very good. Very good. Fine. Let's see what come up. See here, I just used the Nair repertory because I could not find exact any particular mental symptoms. So this was a purely pathological symptoms. I I found out. So here I used the Nair repertory, which is based on the Heron's guiding symptoms. And for me, I found exact sentence to by sentence, word by word in the Nair repertory. Nair repertory gives you the exact proving symptoms, exact description of the prover's language. So I took a rubric, extremities joint, rheumatism, rainstorm on approach of a or a rainy changeable weather. So beautiful. Exact description of the patient. Single remedy rubric. So out of 5 rubric, 4 rubrics are a single remedy rubric. Then I took back, lumbar region, broken feeling, sacral region, worse sitting, better walking or standing, alternate with headache. Single remedy rubric. Inner head, forehead, throbbing pain, preceded by great prostration. And headache alternate with the pain in the back, lumbar region, lumbago, and lumbar region, lumbosacral region. So remedy I prescribed was mellilotus. Just I prescribed single dose of mellilotus in my clinic at around 8 o'clock at night. And from my clinic, they went their village 70 kilometers away, and she called me next day morning. After 2 days, my headache is completely better. Last time, the 2 days back, when I came to your clinic, and after the dose of a medicine, I did not have motion sickness at all. After long, I could travel. And 1 month after, I am absolutely fine. No headache for last 1 month. No joint pains. She is absolutely fine. Mellilotus worked beautifully. And this is last case of today. Before I just stop, this is a case I just came to the remedy in 2 minutes, first 2 minutes. The rest I just confirmed the remedy. In case of allergy rhinitis, male patient for last 3 to 4 years. I said, tell me about your problem. He said, severe violent sneezing. See the word he used, severe violent. He used both the sensation, severe as well as violent, with lots of watery courage and lacrimation, particularly in the morning on waking on. My nose get blocked. When he said first sentence, I was with the remedy. When patient says severe violent sneezing with lot of watery coryza and lacrimation, particularly in the morning or waking on, I was with the remedy. Then he says my nose get blocked. I feel lot of irritation in nose. With that I get a severe headache. I cannot do anything because of my allergy problem. Feel lots of dullness in the morning. Constant watery coryza. They last for 2 hours in the morning. Very difficult situation. Feels troubled. Cannot do any kind of work. Basically, I'm a very quiet person, very sensitive, cannot see suffering of others, and He is highly sympathetic. A lot of anxiety about their family. She takes lot of care of her family members. He gets anxious when anybody falls sick. He is extroverted. He is very communicative. But he says, outside, I hardly share my feelings with anyone. But the person with whom I am very close, I share everything. I am very extroverted person. Very timid, cannot talk to anyone in first meeting, cannot even ask address to anyone if he get lost somewhere. So much timidity. A very strong dish about chocolate, cold drinks, ice creams. But this cold drinks and ice creams causes a lot of cold and cough. Chilly patient. And this question I asked directly. Are you suffering from gout? Because I was sure about the remedy. Whatever remedy I think, there has to be remedy with gout. So he says, yes, I am suffering from gout for last 5 years and my latest uric acid is 7.3. What remedy you think of? Any suggestion?
There are, sir. I think it's of this question. One from Shruti MG saying phosphorus, and with the same
Very good.
answer, with Rekha Parke with the same answer, Parik
Very good.
with the same
Very
answer,
good. Yeah.
and then again there is a person, there is a YouTuber, I guess, Jayaram Vijay Saradhi Meka Pothula, saying
Mhm.
Arsenicum album.
Okay, very good. Okay, fine. Let's see, we don't have a time now. We're already late. Just let go with the case. I took the following rubric. Nose morning aggravation, no sneezing coraza with, no sneezing coraza with excessive running from the nose and eyes only in the morning. Only two remedies there. Nose coraza discharge with fluent, throat inflammation, throat catarrh, and generally food desire chocolates. And the remedy which I prescribed was ammonium phosphoricum. This is based on the synthetic prescription. And I did my MD. This is my thesis, understanding of the synthetic prescription and application of it in homeopathy practice with the help of uh, periodic table. So for me, the doing synthetic prescription is very easy. I'm working on that for last more than 25 years. So this is the synthetic prescription, but not, I can say, only synthetic prescription. Understood on the basis of synthetic prescription, then I work out with the repertory and found exact rubric. And patient is much, much better. So this is all. So what the Boric says about what the patient is suffering from? Gout. The remedy for chronic gout patient, uric acid diastasis, indicated in the bronchitis and the nodocytes of joints of the fingers. What Boric mentions, sneezing with excessive running from nose and eyes only in the morning. This is beautiful exactness. And this exactness, this exactly matching with the Repertory Materia Medica gives me a lot of confidence. Whatever remedy I select, that has to work and it will work. With this, thank you very much for giving me a lot opportunities to share my learning to everyone. Thank you very much.
Thank you,
Any
sir.
question? Yeah.
Still now no questions, sir, and
Hmm.
we are waiting for any question. So,
Okay.
okay, sir, let's wait for 1 minute if possible, sir.
Okay. Fine.
Let's wait for 1 minute. If any viewers having any problems related with the topic, please do make sure to ask it on live chat. We have, sir, for only 1 minute more. So try to ask it on live chat. I know the video is taking 30 seconds delay to you, is reaching 30 seconds with a 30 seconds delay to you. So we will be waiting. So there are there is still some a few appreciation messages are coming.
Okay.
We will wait for 30 more seconds,
No problem.
and
No
after that
problem.
we will see.
Okay. No problem.
Again, to all viewers who are watching right now, please ask if you have any doubt. Please ask it on live chat, as we are going to have serve for more 30 seconds more. So please ask fast if possible on live chat. Sir, let any if there is a question, I think they're typing and it may take time. So spare with us, sir. Sometimes,
Okay.
sir.
Okay. No problem. No problem. I'm free now.
Okay, sir.
I hope session will be good.
Yes, sir.
It was
That
not,
was a brilliant session, sir.
it was
It
not
was
only
just. Huh?
it was not only good, it was too good to understand actually.
Seriously, sir.
See, it's just I try to show the cases, uh, the way I work out in my day-to-day practice. So I'm not gone with any long cases. Other cases, long cases will last for 3 hours, 4 hours with sensation method. I'm not dealing with that things so that it become difficult to understand with the newcomers.
Exactly, sir.
Yes, sir. So we have two questions
Okay.
from now, and it will be showed on screen. Viva ma'am, I'm taking you on backstage for now.
Yeah.
Okay, ma'am. And so, sir, our first question is from Rekha Parekh. She is asking, sir, please tell me how much important give to thermal. I didn't get the question, sir. Did you?
Okay. 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 Yeah. Yeah.
Okay, sir.
See, what I do in my day-to-day practice, as far as I understood the remedy thoroughly, if I see the page completely, I come to the picture of a remedy. Now, this is a case of bryonia. For example, whether patient is hot or chilly, that doesn't make any difference for me. Means bryonia means bryonia. That's it. Doesn't make difference. One aspect never rule out the remedy. So I have seen that bryonia is chilly, bryonia is hot, bryonia is thirsty, bryonia thirstless. All kind of cases I have seen. But when the person is very, very sure and you are not sure about your remedy, for that's it, most important. So many homeopaths are doing, for example, the case of Calcarea carbonica. And patient is hot, they think about Calcarea R, Calcarea sulf, or something like Calcarea muriaticum. I don't believe in that. Calcarea means Calcarea. That's it. Calcarea mur has its own symptomatology. Calcarea R has its own symptomatology. How can I prescribe only on the thermal? How can I change my prescription? On the basis of thermal only. Thermal is definitely important, but not I can just prescribe on that only on that. We can rule out. one aspect. Doesn't make difference. This is my understanding. This is what I am doing for last 34 years and getting results. Hope it's clear.
I hope so. Rekha Parak has got her answer. And so our next question is from Thakar Komal. It will be shown on screen. Just check it out, sir.
रिंगवोम का केस में रिकरर हो जाता है सर, तो उसमें हम कैसे ले सकते हैं? I didn't understand
I
the
think
question actually.
same here, sir.
See,
I didn't also get the question.
just I
Thakar
give
Komal,
answer.
can you just ask it again with a proper typing,
Okay,
with a proper
no
grammatic?
problem, no problem.
Okay.
Most important thing is very difficult condition to treat. Ringworm is not that simple as we talk about, but only thing is the right remedy that helps a lot. If you reach to the right perfect remedy, that only remedy will cure. See, then people will ask about bacillinum and all kind of nosers. So all nosers have their own indications. Now I will not prescribe any noser without any indication. That's my way of practice. Bacillinum has his own symptomatology, his own state of mind, his own state of being. Because the person is suffering from ringworm and not getting better with the remedy. So I prescribe Bacillinum as an intermittent remedy. I will not do that things. For that, I will use any indicated remedy. What remedy came up? That is my way of practice. Okay. Any other questions?
Still, there is no more question. Sir, he has continued his question. You can see it on screen. I hope she has got
Oh yeah.
answer. Hmm.
See,
So, sir,
if
yes, sir,
if
yes, sir.
the, yeah, if it gets recurred, that means somewhere your remedy is not perfect. Somewhere your remedy is not right. Recase the retake the case, understand the patient thoroughly, and try to find the very exact perfect remedy for that particular state of being. I have seen many cases of ringworm. It not get better only with one remedy. Sometimes we have to change remedy according to the state, according to the need of the patient. Okay.
I think so, sir. So, sir, that was the end of it for today's Q&A session. And before going to the vote of thanks part, let me just say a few words to all the viewers. If you want those who have answered right questions, and if you want to get a participation certificate, you can check out the link in the description to get the participation certificate for this program. So now over to Dr. Viva ma'am for to end the session. Viva ma'am, over to you.
Thank you, Dr. Orko. Uh, I can't say thank you because I feel right now the word thank you is not enough to show our gratitude for today's session, sir. It was, I think, a great learning is there in the session, and what I feel is this session is the extract of your years of practice and years of experience actually. So definitely I'm sure that this session is a great learning for all the students and doctor including me also. So thank you so much for accepting our invitation, for taking this wonderful session and showing so much wonderful cases to us. So it's a great pleasure to have you here on our platform today, and we are looking forward for learning from you again and again, sir. So thank you so much for coming today. And thanks to all the viewers for joining us. And the series is still continue. The webinar series is still continue till 10th of the November. Tomorrow with us, a very senior experienced homeopath is also there. Dr. Sunita Gandhi is there for tomorrow's session. So join us tomorrow also, and keep learning with all the experienced teachers on this platform. Thank you so much.
Thank you all. And it's time to say good night to everyone who are watching, and see you soon in our next live webinar. Until then, you go and subscribe to our channel, and also make sure to follow our social media page on Instagram named Aisha, and we will soon provide the link in the description. And again, if you want your certificates, participation certificate, you can go and click on the link down given below in the description, and make sure to click it on after means the submission of the participation certificate will be closed for this session after 23:59 minutes hours. So thank you all. On behalf of Aisha, this is Orko Mukherjee